Mr. President, most mornings, as the Senate is in session, the minority leader comes to the floor. Senator Reid talks for a while, sometimes talks about things in the news. So I come today to the floor to talk about headline in the news today, the New York Times of all places, with a headline, "Obamacare premiums are rising and not by a little." Obamacare premiums are rising and not by a little, today's New York Times headline. Because it's interesting when I hear Senator Reid come to the floor, so often he's coming to the floor to defend the Obama health care law. A couple of weeks ago, he came to the floor and he said that Obamacare, he said, is continuing to work. Those are his words. So today I find it interesting in the New York Times story with the headline, "Obamacare premiums are rising and not by a little." It says, even in urban areas where competition was expected to be brisk and the risk pool relatively young and healthy, expected, that's the key word there, insurers appear to be struggling. In 14 major cities, it says insurers are asking for 2017 increases twice as big as 2016, twice as big as last year, yet Senator Reid says Obamacare is continuing to work. The next day after he said that, he said the Affordable Care Act is working. Well, I don't know anyone who could be a member of the Senate and could actually be going home to their home states on the weekends and listening to people that live in their home states. Anyone who could believe that Obamacare is working. Across the country, people are seeing how much more money they're expected to pay for health insurance premiums next year. Now, I just read that story from today's New York Times, yesterday's Washington Post. Premiums for health plans sold through the Federal Insurance Exchange, the one the Democrats came to the floor, said they loved, was going to work, could jump substantially next year, or the Washington Post yesterday. Perhaps more than at any point since the Affordable Care Act marketplaces began in 2013. Does Senator Reid read the newspaper? Does he talk to his constituents? Otherwise, how can he be so terribly confused about the impact of this health care law and the damage it's done to the American people? So far, 31 states in the District of Columbia have released information on what insurance companies plan to charge next year. The average American is facing premiums that are 22% higher than this year. That's what's bringing about these headlines in the Washington Post and the New York Times. In Iowa, an insurance company says that it wants its customers in the Obamacare exchange to pay as much as 43% more next year. One customer wrote into the state insurance division and said, quote, "You're killing me." Does Senator Reid understand that impact of this law? Another wrote in and said, "Who can afford this? It's disastrous." Does Senator Reid note any of that? In North Carolina, the largest insurance company in the state said it plans to charge people an average of 19% more next year. In Pennsylvania, one company says it's going to charge people up to 48% more starting in January. In Arizona, people are facing premium increases of 53%. That's the average increase in Arizona. So it's not surprising to see a headline in the New York Times today, and I hope Senator Reid read the paper. Obamacare premiums are rising and not by a little. Well, whose fault is this? Who should people across the country blame when they see these outrageous price increases that affect them at home? Well, I believe they should blame Senator Reid and every Democrat in Congress who voted for Obamacare and all of the expensive requirements, regulations, and restrictions. So the question is Obamacare working? Let's use President Obama's standard, the one that he set for himself. Well, he promised if you like your doctor, you could keep your doctor. Well, insurance plans have been trying to cut costs by doing what? Narrowing the network of doctors that patients can see. People are finding that they can't keep their doctors. They've been losing their doctors because the doctor is no longer covered by their insurance. Well, that's, you say, is that just a guy who's practiced medicine for a long time talking? No, it's a whole weekend review section in the Sunday Review of the New York Times. Sorry, we don't take Obamacare. Sorry, we don't take Obamacare. People that have Obamacare, people that actually supported the idea of Obamacare who cannot see a doctor, cannot go to a hospital because of this health care law. President Obama said if you like your insurance, you can keep your insurance. Well, can you? 92,000 people in Colorado are losing their insurance plan because companies are pulling out of the state. 22,000 people in Ohio who are now scrambling to find new health insurance because the co-op that they were in went broke last month. The health care law actually created 23 different co-ops. 13 of them have gone out of business. Over the past couple of years, 745,000 Americans who were promised by Barack Obama that if they liked their insurance, they could keep it, lost their insurance because their co-ops have closed down just under the health care law. Hey, President Obama promised, this is his standard, that under his health care law, the average family would see their health care rates go down by $2,500 per year. Anyone who wants to know if Obamacare is working should ask one simple question: did your health insurance rates go down by $2,500? That's the standard that the Democrats should be held to. Now, we know that Obamacare did take millions of people and put them into Medicaid, which is a failed system, a broken system, many refer to as a second-class citizen, hard to see a doctor, hard to get care. It took other people, and it gave them big taxpayer subsidies paid for by the American taxpayers to help them afford the high premiums, the subsidies to help them afford the high premiums for this overpriced Obamacare insurance. But those people will tell you it left them with deductibles and co-pays so high that they can't actually use the insurance. For millions of other Americans, there are no subsidies, just enormous bills. The president says, well, don't worry, they're going to get a subsidy. But let's take a look at how many people get subsidies and how many people will get none who are buying insurance through the exchanges. According to the Congressional Budget Office, the people that look into this thing, there are 12 million Americans who get some sort of subsidy to buy Obamacare insurance. Premiums go up, the subsidies goes up, but that's a bill that hits the taxpayers, the hardworking men and women in the country who pay their taxes year in and year out. So that's 12 million, but there's another 12 million, an equal number of people who have to buy this insurance without any of these subsidies at all. So when the president takes a look at and talks about these 12 million, that's a significant hit to the American taxpayers, and it turns a blind eye to the 12 million Americans who buy insurance without any of the subsidies. They are left to pay the full freight for the enormous premium increases that we're looking at next year. Well, there was an Associated Press story on Monday. I did the story from today's paper, the story from yesterday's paper, the Associated Press headline on Monday: rising premiums rattle consumers paying their own way. Is Senator Reid and the Democrats rattled by it? They should be, because the American public is rattled by it. Tells the story of a woman from Queens, New York. We have two Democratic senators in this body who voted for this health care law. This is one of their constituents from Queens, New York. She got a notice from her insurance company that they plan to raise her rates by as much as 25% next year. On top of this, her plan dropped the hospital network that she wants. Well, President Obama promised she could keep her insurance, she could keep her doctor, she could keep her hospital. It doesn't apply to this lady from Queens. She says, for people like me who are in the middle, there is very limited choice. She says, and now that limited choice is going to get more expensive. How do the senators from New York respond to that? Why aren't they on the floor talking about it? Well, for most Americans, the Democrats' health care law has meant higher prices, worse health care, less freedom to choose what's right for them and for their families. That's why the polls show that, on average, only 4 out of 10 Americans have a favorable view of the health care law at all. And it's because the premiums that keep going up and up without end are hitting them in the pockets. It's because people are also paying higher deductibles, higher co-payments just to see a doctor. So the Kaiser Family Foundation did a survey, and they said, what about these deductibles? What about these co-pays? What they said is for people that have deductibles of over $1,500, even those people that are getting the subsidies for Obamacare that the president says is so great, 70% of them, when they see that their deductibles are over $1,500, they rank Obamacare as poor value for them. This is a $1,500 deductible. Mr. President, the average silver plan in the Obamacare exchanges here has a deductible of more than $3,000. Insurance plans for next year are starting to come with deductibles of $7,000. How can the president say this is valuable? The people who are getting it, even with his subsidies, his expensive subsidies, paid for by taxpayers, saying this is giving them very little value and is of poor value. That's why this law is so unpopular. That's why Obamacare continues to be underwater in terms of those who support it and those who oppose it. The average deductible for a silver plan this year is $600 higher than it was just 2 years ago. That's why when we see these headlines in the New York Times today, the Washington Post yesterday, you realize that people all across the country are being hurt by this Obama health care law. 1 out of 4 Americans say that they have been personally hurt by the health care law. Not that they know somebody that's been hurt, but they have personally been hurt by the health care law. So even for people who are getting the subsidies for their premiums, the deductibles, the co-pays, they have been rising very fast. You know, people never get to the point of being able to use their insurance. I mean, that's the real problem with this, with the way that this thing was set up. They have coverage, they still can't afford care, and it's interesting to listen to the president's speech. You listen to him very carefully. He doesn't actually use the word care. He uses the word coverage. Well, if you can't get care, coverage is useless. But that's what the president's numbers are. He talks about coverage, refusing to talk about care. This is about health care. As a doctor, people want care, not empty coverage. But in face of all of this evidence, the Democrat leader, Harry Reid, has stood here on the floor of the United States Senate and pretended, in front of the American people, pretended that Obamacare is working. He has repeatedly ignored every broken promise that every Democrat member in Congress made about the health care law. He comes to the floor and has repeatedly ignored every American who has lost their insurance. He repeatedly comes to the floor and ignores every American who has had to pay outrageous amounts of money for insurance that for many of them is unusable, but is mandated by President Obama and the Democrats that they have to buy under penalty of law. None of that seems to matter to the Democrat leader, who personally supervised the writing of the health care law in his office behind closed doors. It's a terribly flawed law, but behind the closed doors of his office, it was written and passed on a party line vote. Look. Well, the American people have spoken, and they have given Senator Reid's efforts and the Obama health care law a failing grade. Even those with the subsidies say it is a poor value to them. Americans all across the country are hurting because of Obamacare, and Senator Reid and President Obama bear the responsibility. How much more do the American people have to suffer before the Washington Democrats will accept the facts? People want the care they need from a doctor they choose at lower costs. Republicans have offered ways to give people what they've been asking for all along. It is time for Democrats to work with us. It's time for Democrats to stop trying to deliberately deceive the American people by pretending this broken health care law is working. Pretending. That's what this is all about, because it's not working. Obamacare remains very unpopular because people realize that for them personally, it's a very bad deal. But Republicans have better ideas, better solutions. Republicans are offering the American people the freedom, the flexibility, and the choice that they want when it comes to their health care. Thank you, Mr. President. I yield the floor.